Hello everyone, good to see you all. Today we are going to revise pediatrics for the upcoming July 24 FMG exam. You're all going to pass. Stay motivated and stay tuned to focus more on the IEL images and the IEL contents. Let's dive into the lectures. So the first image here, this is going to be what? Infantometer. Yes, this is used for infants. Remember, those children who are less than 365 days are called as what? Infants. Infantometer. Next, this image over here, this is called as what? Herpendens caliper. This is used to measure what? The skin fold thickness. Yes. Next, and this is going to be what? Stadiometer. Good. Mid-arm circumference is actually measured via a tape called as Shakir's tape. Remember, it is a special tape used to measure the mid-arm circumference, and it can be bought in Amazon for about 200 rupees as well. Now, what you're going to do, you're going to tie the tape around the upper arm of the child. If the child's upper arm measures to be about 13, it means the child is healthy. No acute malnutrition. It means the child is having moderate malnutrition. If the red that is going to be less than 11, if it is mentioned, it means that the child is having severe acute malnutrition. Very important to remember. Now, remember, in the newborn, the head circumference is almost equal to what? The chest circumference. This is also need to be remembered. Apgar score is very important for the exam. Let's revise very quickly. A is for what? Appearance. P is for what? Pulse. G is for grimace. A is for activity. And R is for what? Respiration. You have cleared your FMG exam and right now posted in the OBG labor room. And just you have delivered a baby. And the baby, this is how it looks like. It looks very pinkish. Good. You're going to give 2 points for that. And you hear the heartbeat is also 100 plus. Again, you're going to give 2 points. You see the reflex is very good. So the response also very good. Having a good simulation. Again, you're going to give 2 points. Next, you see the activity. The tone of the baby is also very active. And the baby has just cried right after the birth. So congratulations. You have delivered a healthy baby. The baby is in excellent condition when the Apgar score is 7 to 10. Very good. If the baby's score is going to be 4 to 6, it's moderate. If it is going to be 0 to 3, it's severely depressed baby. Good. Now let's revise quickly. A, appearance. If the baby is going to look pink color, you're going to give 2 points. Heart rates over 100 BPM, you're going to give 2 points. And again, if the response stimulus is good, you're going to give 2 points. The baby is going to be active, you give 2 points. And the baby has given a vigorous cry, again, you're going to give 2 points. If the baby is completely doing the opposite, if there is no pinkish, it is only blue and pale, 0 points. If the pulse is absent, again 0 points. If the grimace is absent, floppy, 0 points. Next, no respiration, so you're going to give 0 points. So in Supreme, remember, Apgar score, the baby is going to be what? Pinkish. Again, BPM is going to be above 100. We have prompt response, the baby is going to be active and also would have given vigorous cry. Something you're going to remember is going to be, if the baby is going to have what? Flexed arms and legs, you're going to give 1 point. Yes, please remember this. Good. And if the baby does not cry, remember, what are you going to do? Initial steps is going to be, remember the mnemonic PSSR. PSSR. Remember, positioning, suction, simulation, and reposition. That concludes Apgar. Vitamin deficiencies. Vitamin deficiencies we have already seen in biochemistry, but let's try to quickly revise one more time. Now, vitamin A, of course, if you're deficient, you can have loss of visions. Yes. Vitamin B1 will lead to beriberi, weakness of muscles. Yeah. Vitamin C, if you have skin, it will lead to what? Scurvy. Vitamin D will lead to rickets. Calcium deficiency can lead to what? Bone and also tooth decay. Iodine deficiency can lead to goiter, and anemia deficiency can lead to what? Dentition is a very important topic. Revise. Let's revise image. Look at the first one here. This is going to be what? Central incisors. Upper central incisors and the lower central incisors. The lower central incisor is the first one to erupt. Next, we have the first molar. Look at the first molar here, and then we have the second molar. First molar. Remember, first to appear in secondary dentition is going to be what? First molar. Primary dentition, which is also called as what? Milk teeth or temporary teeth. Secondary dentition is going to be the permanent teeth. Yes. Number of milk teeth is going to be 20. Number of permanent teeth is going to be 28 to 32. Yes. Vitamin B3 niacin deficiency will lead to a condition called as pellagra. We studied this several times. It comes with 4 Ds. What is going to be? Dermatitis, diarrhea, dementia, and death. It has a very important sign. This is going to be what? Cazal's necklace. Yes. Cazal's necklace has been asked several times in the exam. Vitamin C deficiency will lead to condition called as what? Scurvy. It will lead to swollen bleeding gums, and it will also lead to what? Collagen defects, and it can lead to pseudo paralysis. Vitamin C deficiency also will lead to what? Impaired wound healing. Very important to be remembering. Anencephaly is the failure of closure of what? Anterior are the cranial neuropetra at the anterior region. Therefore, the defect is going to be at the cranial or the anterior part of it. Nice. Spina bifida. It is the failure of closure of what? Caudal or the posterior neuropetra by 27th day. This is called as what? Spina bifida. Remember, anencephaly by 25th day. Yes. Beckwith-Weidman syndrome, very important. Let's at least remember 3 conditions. That is going to be macroglossia. We have umbilical hernia. Remember also lateralized growth and also ear creases. Let's revise once again. Macroglossia, umbilical hernia, lateralized growth and also ear creases. In Alagille's syndrome, remember butterfly vertebra, triangular face and also posterior embryotoxon. Alagille syndrome, butterfly vertebra, posterior embryotoxon and also triangular faces. Tetralogy of Fallot is a very important condition. Remember, it has what? Boot-shaped heart. Yes, boot-shaped heart is seen in tetralogy of Fallot. Question number 1. Next, remember, it comes to the mnemonic PROV. P. First P. P is for what? Pulmonary stenosis. Next, we have what? Right ventricular hypertrophy. Yes, we can see the hypertrophy, whereas in normal heart, there is no hypertrophy. Next, we have C, can also see overriding of aorta. O is for what? Overriding of aorta. And V is for what? Ventricular septal defect. Comes to the mnemonic PROV. P-R-O-V. P is for, once again, pulmonary stenosis. R is for right ventricular hypertrophy. O is for overriding of aorta. And V is for ventricular septal defect. Yes. DiGeorge syndrome is very important. It is also called as what? Velocardiofacial syndrome. It comes to the mnemonic CATS. 22. Let's revise it. C is for cardiac defect, A is for abnormal facies, T is for thymic apoplasia, P is for parathyroid apoplasia, H is for hypotonia and also hypernasal speech. It is due to what? 22q11 chromosome. Yes, it is going to be autosomal dominant. We are very much aware that the breast milk contains all vitamins except vitamin K and D. Therefore, we are going to give what? Vitamin K administration via IM. Yes. When the baby's kg is more than 1, you are going to give 1 milligram of vitamin K IM. If the baby is weighing very less than 1 kg, you are going to give 0.5 milligram of IM vitamin K. Vitamin D, whereas you are going to give in syrup form, you are going to give for term babies 400 international units and preterm you are going to give 800 international units. Please remember, breast milk is rich in what? Vitamin A and C, but it's deficient in what? K, D and B12 if the mother is going to be what? Vegan. WHO classifications on pneumonia. You have passed FMG exam. Right now, having your own clinical practice, your own setup. A mother brings a child 2 to 59 months of old who is having cough and breathing problem. As a good doctor, what you're going to do? You're going to observe the baby. The baby is only having what? Cough and cold. No other problems. In this case, you advise for home care. You see the baby is having fast breathing and the chest is also indrawing. It could be pneumonia. Therefore, you start what? Oral amoxicillin and also for home care. Now, you see a general danger sign. You see the chest is indrawing more. It could be what? Severe pneumonia. In this case, we are going to give first antibiotic dose and we are going to refer the baby to the higher center. Yes, that is what you're going to do so that he or she can receive what? Injectable antibiotics and also supportive therapy. Remember, chest indrawing could be pneumonia. Chest indrawing plus the danger sign could be what? Severe pneumonia. Yes. Erythema toxicum, remember erythema toxicum, this is the image of erythema toxicum. This is going to be self-healing. Yes, most common rash in the newborn. Now, bronze baby syndrome, remember there is going to be dark pigmentation. You can see dark pigmentations on the skin due to phototherapy. As we all know, this is going to be what? The Mongolian spot. It is due to the dermal macular melanocytes, and it is also what? Self-healing condition. Tracheoesophageal fistula has been asked in the exam. Remember, it is going to have blind esophagus. Yes, the esophagus is actually connected to the trachea. That is why it is called as what? Tracheoesophageal fistula. When you insert a nasogastric tube, what happens? It coils because the esophagus is blinded. Yes, this is how it looks in the X-ray, and it is mostly due to what? Polyhydramnios use. Now, remember the classification system. At least remember type A, type C, and D. Remember, type C is going to be most common. Type C is most common to A and D. Remember this. Yes, as the time is short. Jaundice is very important to revise. What happens is, after 120 days, the RBCs goes to the spleen for destruction. Yes, and once it is destroyed, we have unconjugated bilirubin bound to the albumin. It goes to the liver where it becomes conjugated, and the bilirubin glucuronide gets into the guts. Now we have what? Byproduct of urobilinogen and also stercobilinogen. Urobilinogen gets secreted via urine, and stercobilinogen gets secreted via feces. Yes. Now we have two types. One is going to be conjugated and unconjugated. Remember conjugated, remember the mnemonic doctor. D is for Rubin-Johnson syndrome, and R is for what? Rotart syndrome. Unconjugated is going to be Gilbert syndrome and then Crigler-Najjar syndrome. Yes. Now remember, Gilbert syndrome is going to be due to immature UGT, and Crigler-Najjar is going to be absent UGT. Yes. This is the baby of what? The eyes having yellowish discoloration, that is due to neonatal jaundice. Chickenpox and measles. Chickenpox is caused by what? Herpes zoster. Question. It has dewdrop on rose petal appearance. Yes, dewdrops on rose petal appearance. Measles, it's actually a skin rash. You can see it here. Most common complication can lead to otitis media. Most common cause of death could be due to pneumonia, and late complications can lead to what? SSPE. Now, chickenpox and measles, how does the clinical presentation happen? Remember, in chickenpox, the patient is going to have fever, headache, decreased appetite. Remember, decreased appetite is seen in the chickenpox. Whereas in measles, again, the patient is going to have fever. He or she is going to have what? Red rashes around the body, red inflammation of the eyes, a runny nose might be there, and you're going to see what? Very important spot called as what? Koplik spot. Yes. Look at the image of marasmus and kwashiorkor. It's very important because we get confused very easily. Let's go. Marasmus. What happens is the baby is going to have what? Shrunken abdomen. Please revise. Marasmus, shrunken abdomen. Whereas in kwashiorkor, there is going to be protruding abdomen. If you know these two, you'll get the answers very easily. Now, let's revise the important components. Marasmus is due to what? Low calorie intake. Low calorie intake. Therefore, if I don't eat well, will I grow? No, there is going to be what? Severe growth retardation, and my stomach is going to be like this. No way, it's going to be shrunken. So the baby is going to have what? Shrunken abdomen. The baby now requires what? Adequate protein, fat, and carbohydrates. Whereas in kwashiorkor, it's a different story. The kwashiorkor patient usually requires what? Adequate protein. Yes, very important. Remember, this is due to low protein intake, mild retardation will be there seen, and also protruding abdomen is seen, as discussed earlier. Protruding abdomen is seen. Classification of dehydrations. Let's revise and focus on the very important ones. Now, no dehydration. What you're going to give? You ask the patient to take fluids and also the food. Easy. In some dehydration, remember, the patient is having some kind of dehydration. In some dehydration, you're going to check for this skin pinch. It goes back slowly. In case of severe dehydration, the skin pinch goes back very slowly. This is where the examiner always traps us, and this could help you to solve the question. Now remember, in some dehydration, the skin goes slowly, restlessness and irritable. In these conditions, you're going to give fluids and food for some dehydration. Next, if the child has severe classification, refer to the higher centers. Yes, in severe dehydration, as we have just seen, it is going to be very slowly. When the skin pinch is done, it's going to go very slowly. Yes, and the baby is going to be lethargic and also unconscious. In these conditions, you're going to give fluid for severe dehydration and also refer to the higher center. Yes. Glycogen storage disease is very important. Let's revise quickly. Type 1 is called as what? One-gear key. This is due to glucose 6-phosphate. Type 2, POMP is due to lysosomal. Type 3, C for Cori, due to debranching enzyme. Type 4, Anderson's, due to branching enzyme. A to B, C to D. Yes, McArd's is due to muscle glycogen phosphorylase. M for M. Hirsch is due to hepatic glycogen phosphorylase. Yes. Laryngobronchitis group is going to have what? Due to para-influenza virus. Question number 1. Patient is going to have what? Basic stridor. It causes respiratory distress, and we will see classically a sign called as what? Steeple sign. Very important. Yes, we are going to give airway management. Next, we have acute epiglottitis. We are going to see thumb sign. It is the infection of what? Supraglottitis, and it is caused due to Streptococcus pneumoniae. Yes, the patient will have what? Eye fever because it is due to a bacteria, and drooping of saliva as well. Now, what we are going to treat? We are going to give secure the airway by intubation, and we start antibiotics and also steroids. Remember the image of acute epiglottitis. Congenital diaphragmatic hernia. This is the image of what? Congenital diaphragmatic hernia, CDH. Respiratory distress in child will be seen, and then air bubbles can also seen. Next, please remember, respiratory distress syndrome is mainly seen in womb preterm babies, and white out lung is also seen in CDH. Important one-liners. Most common type of seizures in children is going to be what? Less than 2 years. That is going to be febrile seizure. Injection of vitamin K prevents hemorrhagic diseases of newborns. Very important. Let's revise few questions which have been asked recently, and one by one. Let's go. Breastfeeding should be continued for minimum of how many months? Try to think. That is going to be 6 months. Very good. In which micronutrient deficiency diarrhea and following manifestation is noted? Look at the image here. You can see something in the neck, and the information is already given. Cazals necklace is due to which condition? That is going to be due to niacin. Yes. In a child with malnutrition and conjunctival xerosis, which of the following should be administered? Conjunctival xerosis, eyes. It could be due to what? Vitamin A. Yes. The following conditions occurs due to failure of closure of neuropore at what time of gestation? Look at the image carefully. What is this? This is anencephaly. We have just discussed about this few slides ago. Try to go back, look at the slides, and try to comment the answers. Answers in the comments. A child with diarrhea was eager to drink. Okay. Skin pinch goes back slowly. The examiner has given a hint. As per IMNCI classification, what should be the color coding? Very important. We have seen, remember what is the color coding? It was green was for normal, yellow was for some dehydration, and pink was for severe dehydration. Therefore, the answer is going to be what? Yellow. You guys have been doing an amazing job over the past months, and now this is the time where you're going to focus more on the revisions consciously. Yes, conscious revisions required, and you will definitely pass this time. Stay focused, stay motivated, and you will prove the society your worth, and especially to your own self that yes, you are capable of doing it. You will rock it. For PDFs, kindly message me in Telegram or Insta. We'll keep you posted. Wish you guys all the best. Thank you.